You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Boca Raton, Florida's go-to implant oral surgeon. With us we have Dr. Jason Portnof. Dr. Portnof, welcome to the program.
Thank you for having me.
Now, you brought some photos, so we'll get to as many of those as possible. But for people that don't know your practice, and I know as an oral surgeon, you do a lot of different things, but who's a typical dental implant patient?
So we have generally about 3 different types of patients that come for dental implants. The first patient might have in their mouth teeth that are falling apart. They're decayed, they're infected, they're damaged, they're not chewing properly for them, and they're not eating what they want to eat. They're really, their quality of life is going down. And they want to know what type of, what type of teeth can they get? How can they be restored to better health?
So they don't want dentures.
They don't want dentures. They want something else. They've never had a denture. A denture is something that goes in the mouth. It moves around. It's not, balanced and sturdy. They want to be able to chew like they used to chew, but they want to be chewing with solid foundation teeth. So we can offer that with dental implants. A second group of people that would come might be denture wearers that are sick of the dentures. They've been chewing sorta on food that is soft, mushy. They're not eating the steaks that they want to eat. They're not eating the apples that they want to eat, and they want to be able to. Now they've seen something online or on TV. They want to be able to chew with fixed implant retained teeth.
Okay. Is this true though? Like on the day of the procedure, a denture wearer, correct me if I'm wrong, can walk in with no teeth and walk out with upper and lower teeth that don't come out?
Absolutely.
A full arch of teeth?
Absolutely. The right candidate, if we can get those to fit for them on that day, we'll do it for them.
Okay, good.
So the third group of people have what we call patchwork dentistry, right? So a little bit of work here, a few years later, a little bit of work here. Nothing's kind of balanced. They might have grinding. They might, be clenchers. Their teeth are breaking down, and they're destined to become either denture wearers or implant patients. So for those people, we can give them a brand new set of upper and lower teeth supported by dental implants.
Okay. Now, at the top of the show, I said nobody should be wearing a loose-fitting denture. Do you think that's the future of dentistry? Is that dentures, as we know them today, not attached to anything, maybe 20 years, 50 years, the future, they'll all be attached to something?
They all should be attached. I think they all should be attached to something, because when you have a denture, initially it might fit. Then a couple years later, you have to come in for what they call a reline, which is basically, the denture doesn't fit anymore. It's sliding around in the mouth, and they have to add additional material to the denture in order for it to fit securely. And that will last for a little bit of time, but eventually you're coming in for another reline, and eventually you're coming in for another one. So over time, that denture is no longer going to be sturdy. It's no longer going to be effective, and you're back to eating, pureed diet or soft food that you don't want to be eating.
Let's talk a little bit about your background. So you're a medical doctor.
Yes.
Also a DMD. And you work together. I guess your typical patient, oftentimes general dentists will send you their implant procedures. Is that correct?
Correct. Yes. So I'll have a lot of referring dentists that will see a patient that, like in the categories we just described, they know implants are a good solution for them. And basically they come to me. We'll treatment plan the patient together. So the patient can still use their dentist that they've been seeing for years and they're comfortable with. And a lot of times that dentist will come to my office and we'll treat them together, under one roof. We can provide them the surgical implant and then also the restoration or the teeth that they want. So
most of what we're talking about today, you teach dentists across the country. Is that correct?
Yes. Absolutely. So right after I finished my training, I actually went into faculty practice, right? I taught in academics for about 10 years before.
Where?
Well, I started in New York at Albert Einstein College of Medicine. I then moved to Florida, and I've taught for full-time faculty at Nova Southeastern University College of Dental Medicine, where I'm still adjunct faculty.
Okay.
I still have students that come from Nova's medical school actually to my office for their first rotations in clinical practice. And then I also still treat patients with the residents at Nova Southeastern and the local hospitals where they cover.
So it seems like a real healthy place, Florida. But are there really a lot of people that are either wearing a denture or headed to a denture?
Absolutely. So Florida, yeah, it's healthy. We have the sunshine, we have the beaches, but we also have an aging population, people that are either retired or what we call snowbirds that move down to Florida, either half the year or longer. And we have patients that, have teeth that, that had bacterial infections. They were, problems with their teeth, and now they're looking for a better solution for their.
Because they don't want dentures.
They don't want dentures, so they're looking for something else.
Because there's a lot of awareness now, I guess, about dental implants, right? Do you have a bias? I'll put you on the spot here. Do you think if you're going to get this done, you might as well go to an oral surgeon? Because as you explained to me in the green room, it doesn't cost more to go to an MD that is an oral surgeon that does it, I guess, at the highest level.
Right. So I think you want to go to the surgeon or the practitioner that's going to do it right. You want to get it done the first time. You don't want to have to redo it. So I think going to somebody who's got the training, who's got the expertise, who's got the patient, pool behind them that they've been doing this for a long time, I think that's the right person.
And it doesn't cost more to go to an oral surgeon to get this done.
No, it shouldn't cost more. Sometimes it'll cost less because you're not redoing it.
Okay. Now, you brought some photos. What are we looking at over there?
So we have some photos of some of my recent patients that I wanted to share with you.
Okay.
These are some patients that really got a great result from implant dentistry. So the first gentleman actually had upper plate or full denture.
Do they call them plates over there?
They call them plates, yeah.
Okay.
Sometimes they call them plates. So this was a denture that came in and out of his mouth. He wasn't happy because he wasn't eating the foods that he wanted to eat. He could have gotten just another denture or a reline of his denture so it could fit better. But he had these dentures for a long time and they weren't fitting. He didn't want to go through that route again. He wanted something that was fixed, that stayed in his mouth, that wasn't coming in and out. He wanted to smile with confidence, and he wanted to be able to eat and chew whatever he wanted. So we offered him implant retained fixed teeth on the same visit. One visit.
Is that right?
Implant went in, prosthesis or teeth went in same time by his dentist, and he left smiling and happy.
Let's take a look at the photo on the after. Very nice.
So yeah, he's thrilled because he can eat whatever he wanted. I remember one of the first things he wanted was a steak, and he was counting the days until he could get that steak, and so now he's eating steaks, left and right.
How soon can you eat after you get your new teeth?
So they can eat that night. Post-operatively, they can eat the same day. We're just going to ask them to take it easy a little bit. A little bit mushy, nothing too strong. Until they heal a little bit more, and then they're eating everything.
So, I mean, literally you could bite things like a carrot, a raw carrot with your front teeth, or you have to be careful with stuff like that?
Once the implants are integrated and secure, they can eat whatever they want.
And do they?
Yeah,
do they ever
absolutely.
Call you and say, hey, doc, are you sure?
Absolutely. They're thrilled with what they're eating. We get updates, like I'm eating carrots, I'm eating apples, everything. They're thrilled to tell us.
What's it like when they see themselves in the mirror for the first time?
It's remarkable, so a lot of times they're used to not smiling, right? They haven't smiled in years, so they're used to having frown lines but not smile lines, so
Okay.
So now, once they get the new teeth, it's almost it's awkward for them at first because they haven't smiled for so long, but now they're beaming, they're absolutely thrilled to have these.
You say that when it's all done, it's like their personality changes.
Personality
Can you elaborate
changes,
on that?
Personality changes immediately. A lot of times, actually, I remember one gentleman that was, like sourpuss, coming in,
Okay.
just not happy. We thought we were doing something wrong when he come in because he was just, had like a black cloud, around him, sort of like that Peanuts character with the,
Yeah.
But then once we gave him teeth that didn't come out, fixed a implant retained teeth. He was smiling. He was a different person. Whistling when he comes into the office. Even flirting a little bit with our staff. So it's a totally different.
So it's like what their
personality.
self-esteem is improved.
It brings out the person they used to be. So yeah, their self-esteem
That's a good
is
way
improved,
to put it.
and they're back to who they feel more comfortable being.
Now, look, I know. Look, I don't know, but as a medical doctor, as an oral surgeon, I mean, you rebuild people's faces, their skulls, and all that stuff. But I think we had a little discussion that this is a very happy group of patients, very rewarding for you.
Absolutely, yeah. So
that you've learned actually
Yeah.
what a big deal it is to go from no teeth to teeth.
These are dramatic makeovers, we can call it. They're cosmetic, functional. The patients are thrilled with the outcome. So, sometimes we're just helping people a little bit, but this is helping people a lot. So it's pretty remarkable.
What about pain? Seems very painful.
So it's not as painful as these patients anticipated it would be. Most of them are thrilled with the outcome and tell me it wasn't as bad as I thought it was going to be. All of them are numb during the procedure, different levels of sedation, whether it's nitrous oxide, some people do local anesthetic only, and we do IV sedation or twilight sleep. So any level of sedation that the patient requires, we can offer.
So you teach safety to other doctors?
Yes.
And medical doctors as well.
Absolutely. So I'm on the board of directors for the American Dental Society of Anesthesiology.
Okay.
So I give lectures nationally, to dentists, to healthcare providers about sedation, about, medical management of patients. We offer any level of sedation that the patient might require. Some patients just require a calm environment with their choice of music.
Is that right?
Absolutely. This patient who we talked about a minute ago, wearing a Grateful Dead shirt, and we offered him Grateful Dead music, while we were doing his procedure,
Is that right?
and he
Okay.
chose it right away. So, absolutely. So whatever will make the patient more comfortable in our office, that's what we provide.
Now, with this IV sedation, they have very little memory of, they lose track of time, or
Right. So
and like amnesia effect?
Absolutely. So we use different medications for different reasons. We can provide IV sedation, twilight sleep, where the patient has no memory of the procedure at all. They're very comfortable during the procedure and post-procedure as well. There's different medications that we use for pain management. There's different medications that we use to erase the memory, basically a memory eraser. And
So they kind of come out of it and they have teeth.
Absolutely. They just wake
Really?
up and they're happy and they're smiling.
Now, back to an original question about, there's a lot of people in Florida in general that have an upper lower denture. Would you say there's thousands, tens of thousands in the state
Absolutely.
that have an upper lower denture?
Tens of thousands in the state with an upper lower denture, and there doesn't need to be.
Why aren't they doing it then? If implants are so good, you're getting new teeth supported by dental implants, why aren't they doing it? What's your take?
I think they don't know about it. I think they think they're not a candidate for it. So let's say you've had dentures for years, right? For decades. And that's all you're used to. You haven't been to the dentist in a long time, and nobody's told you about your options, right? So you haven't been to the dentist who would explain to you that you don't have to wear dentures anymore. We have implants that can help you chew like you did before you had dentures. And I think that those patients need to be educated, and until we can educate those patients, they're not thinking of themselves as candidates.
And I think you told me you could probably help the denture wearers the most, but it's hard to get them in.
Absolutely. And some people maybe they were told by a dentist in the past, you're not a candidate for dental implants. And maybe they weren't a candidate for dental implants many years ago.
But isn't it true though, if you've been wearing a denture for like 10 years, you can't do this, you don't have enough bone?
Well, it's not true, because
we
can find the bone. So there's things that we have, these tools that we can use to help you become an implant candidate if you were told you weren't a candidate before because you don't have enough bone. We can use cone beam CT scanners. These are dental CT scanners that use less radiation than a medical grade CT scanner. And we can look in 3 dimensions at your upper jaw, at your lower jaw, and we can see precisely how much bone you have. That in combination with digital scanning of your teeth.
So the impressions, the goop in the mouth is...
No more goop.
No more goop.
No more goop.
Really?
So we use little cameras that will digitally scan the teeth. It's there. You don't have to open your mouth as wide. You don't have to open your mouth for as long. And we can get a record that we can combine with that CT scan, that dental CT scan, and we can precisely plan implant placement prior to your surgery. We call it
on a computer.
On a computer.
Right?
We call it computer assisted planning or virtual surgical planning. But we can do the surgery essentially on the computer prior to doing it on the patient, so that we have less time that we're wasting during surgery, right?
So it's not always done this way.
It's not always done this way. No, it's not always done this way, but it should be always done this way. The technology is there, and it's been there for a number of years. So for dentists that don't embrace this technology, I think that they're kind of behind the 8 ball. I would recommend.
How do they normally do it then if they're not planning it on a computer?
Well, then you have a lot of guesswork, and they have to make big incisions. They're making these decisions on the day of the surgery while you're sitting in the surgeon's chair, right? So
like they're looking for bone.
they're looking for bone. They're looking at the width, the height, the quality of the bone. These are things that we can assess preoperatively, using the right technology.
Did you ever do it that way?
I was trained on it the old way, right? But that was many years ago. So now, as I've practiced and I've learned the things that work and the things that don't work, and we know that the technology is there, and we need to use it.
Now, what about gum disease? I have a question for you about that. So if somebody has gum disease, like bleeding gums, loose teeth, can they still get implants, or their gums are too bad to support an implant?
Absolutely, they can get implants. So yeah, they might have an infection that's brewing under the gums, and we need to clean that up, right? We need to get the bad teeth out, the teeth that are infected out. Once the teeth are out, that's the nidus of the infection. That's the problem. Once we get the bad teeth out, we clean everything up. Now the bone can be healthy.
So they have gums? They get healthy again?
They still have gums. Yeah, the gums are now rejuvenated, basically. Now that the insulting injury is out.
What about bad breath?
Bad breath, bad breath is due to the bacteria that are in the mouth that is pathologic, and once we clean that up, then the patient's breath is improved.
Now, because it's an infection, do they report, because there's an immune response, do they report they have more energy after it's all done? That means once you clean this infection up and they get their new teeth?
Yeah,
have you heard anything like that?
Absolutely. I mean, I think that's multifaceted. I think that, once if you have an underlying infection anywhere in your body and you can get rid of it, you're going to feel healthier, right?
Okay.
The mouth is the bridge to the rest of the body. We've seen the link between oral health and systemic health. But also, I think that once they're smiling more, right? They're walking past, the people, they're smiling, people are smiling at them, they get invigorated, right? Now they're happier, So I think
and they're eating better also?
They're eating better, their diet is improved. They don't have to rely on fast foods that's kind of geared toward the patient or the person that doesn't have teeth or has, teeth that are not strong. Now they can eat whatever they want. They can eat better quality of meats, a better quality of vegetables. Everything is better. Their life is better.
Now, insurance. We need to mention, like Medicare, Medicaid doesn't really cover this. Even the best dental insurance covers a small portion. But you say people are financing this.
Correct. So my office manager and my office admin staff, they are terrific at working with insurances, but unfortunately, sometimes it is not covered by insurance. So a lot of people are financing this, and we have programs in the office that you can help you with finance. Absolutely, I think the people find that it's a value that they are willing to pay for because they want to be able to smile and eat and chew and live a healthy life.
How old can you be? Like, what's the upper range, or what's your oldest patient that got this done?
So my office is in Boca Raton, Florida, and we have a population that spans from 0 to over 100. I have patients on in my patient family that are over 100 years old.
Wow.
So any age.
But why would somebody 80 or 90 want to do this?
Because they want to eat. They want to enjoy life.
That's fair.
When you're 80 and 90 years old and you've retired, and what do you do with your friends? You go out and have a nice meal. They look forward to it all day or all week. So in order for them to enjoy these meals and these things, they need these implants. That's what they want.
Now, we joked about this off camera privately, that the most expensive part about this is going out to eat all the time. They tend to go out to eat more.
Absolutely. So on TV, they're watching Anthony Bourdain, they're watching, Stanley Tucci, and they want to eat those meals that they're seeing. And they're tired of eating, the mushy, ramen or whatever they're eating while watching, Anthony Bourdain with these beautiful, elaborate meals. So now they're candidates to eat whatever they want.
So what do they like more, the way it looks or what they could eat?
I think it varies by patient, right? And the patient that comes in thinking about only function, within a short period of time, they're happy with the way it looks. They're happy with the reception that they're getting from other people. They're smiling more. People are smiling at them more. And then, now they're happy with everything. So, and vice versa. The people that just want to smile better, they're smiling more. Now they're eating more. Everybody's happy with the outcome regardless.
Okay, you brought another photo.
Yep. So I have another patient I want to talk about. So I met this patient in the hospital, actually. He developed a bad infection that started out, gum disease, infected teeth that wasn't treated properly. And over time, that just kind of advanced and it got into the bone, eventually got into his soft tissues. He was swollen. He couldn't open his mouth. So I saw him in the hospital. He was getting IV antibiotics. And we had to clear the infection. Once the infection was cleared, he came to my office, and that's where we started treatment planning and thinking about what options he would have to fix his smile.
What were his options?
So he was either going to be a patient that would be a denture patient. We would have to take all his teeth out and be a denture patient. But really, he wanted implant fixed teeth. He wanted to have
Teeth that don't come out.
teeth that don't come
Okay.
out. So, and that was an option for him. We did a 3D scan of his teeth. We did a 3D scan of his bones. We precisely planned where the implants would go. And in one day, we removed the teeth, we put the implants in, and he left with his smile intact.
Very nice.
Thank you. So, this patient initially wasn't happy with his smile. His teeth were infected. They had decay. He wasn't eating things that he wanted to eat. He was limited in his diet. His health overall was not the best. And I worked with his medical doctors, before surgery to figure out how he could be optimized prior to surgery. So we do that a lot in my office because of where we are, and our office is on a hospital campus. So a lot of the doctors will refer patients to us. So we'll get referrals from MD, their primary care doctors, as well as their dentist, right? So we're getting referrals from both medical and dental physicians. Yep. So let me show you this patient. So this guy comes to us, and he had in his mind that he wanted dental implants to replace the teeth that he had.
Okay.
When he was eating, it was painful. He wasn't eating the diet that he wanted. He was eating a mushy diet, a bland diet. It really wasn't exciting for him, and he really wanted to change his diet. So he wanted to see what options he had, and we offered him multiple implant placement that would retain his teeth. Right?
Okay.
In the end, he was thrilled with the outcome.
Very nice. They look natural.
They do, and they, as far as he's concerned, he's eating what he wants. They feel good to him.
Now, we're short on time, but if somebody's watching this and you say there's two main categories, the people, they still have teeth and they don't want a denture, but they're really bad teeth, they have to come out, or the denture wearers. So when they go to your office, what are their options when it comes to dental implants?
Right, so there's different options. So the first option might be a couple of implants that a denture can snap in and snap out of, right?
So like two implants.
Two implants in the front.
Snap in, snap out.
Snap in and snap out.
Okay.
That means the patient can remove the denture at night, clean it, put it back in. It's not the best option because while it's implant retained, so it's better than a denture, it's still a denture in some respects. It still rotates a little bit. There's still some movement. It's not perfectly stable.
Okay.
So the next level up would be as little as 4 to 6 implants, a full arch of teeth that are retained and don't come out, right? These teeth stay in permanently. The palate is now your natural palate. There's no covering of the palate. So
but isn't the upper denture okay because of the suction?
Well, it's okay, but it's not great, right? So there's no palate on your natural teeth, right? There's no coverage of your palate on the natural teeth. So you want to try to recreate that. So with these multiple implant retained, teeth, this would be a way for them to chew, function without anything coming in or out. They have full exposure of their palate. They can taste better. They can chew better. They can function better. They can smile, healthier. So this is the way to go.
So you're not a fan of the snap in, snap out teeth?
I'm not a fan I'm a fan only if that's the only choice you have, right?
Okay.
But if you can choose between that and this last option where the teeth are remaining in the mouth at all times, I think that's definitely a premier choice.
Now, I know you want to be positive today, but I think you told me that the new guys, the new dentists that are doing implant dentistry, start out oftentimes with the snap in, snap out teeth.
Right. So
is it easier? Is that why?
It's easier. You're only placing 2 implants, right? So, usually, the fewer implants, the less complicated. Now we're placing multiple implants. It's more complicated, but in the hands of the right surgeon, you're going to get a good outcome.
Now we're out of time, but final message. Okay, so you got 2 groups of patients. So they have teeth, but these teeth are bad. They have to come out. Or the denture wear. Let's say they've heard what you have to say, they're watching this, but maybe they're still skeptical or afraid. What do you say to them?
I would just invite them in. Come in for a consultation. Let us do our exams. Let us figure out if you're a candidate for dental implants. I think you probably will be. And let's look through the process together, and I can answer any questions that you might have.
That's very nice. Now, is it true that in as little as like 3 visits, you can go from no teeth, 3 visits later, and you get your upper and lower teeth that don't come out?
Absolutely. So the first visit, we can meet, we can do a consultation, we do our record taking, and then the second visit, we can kind of show you the treatment plan to see what we're going to be doing and walk you through all the steps. And then the Third visit will be your actual surgical procedure. And then you come back for a post-op. And then a lot of times we want you back a few times, and a lot of patients are so happy with us that they just come to visit. So
really, people actually come and they just want to say hi.
They just want to say hi.
And they maintain them just like regular teeth.
They maintain
like every
them
6 months.
Every 6 months, they maintain them. They go to their dentist, or our dentist in our office, and they come. They get their cleaning. They have the denture removed. Gums assessed and then replaced, and just like every other person goes for a 4 to 6 month visit.
And for people that have some insurance, you will, after you meet them, you'll tell them how much insurance will cover.
Absolutely. So we have people in our office that work exclusively with insurances, and they're checking to see what benefits you have, what benefits are excluded, and they'll go through all of that before your visit so that you know exactly what's happening.
We are out of time, but I want to ask you this question. So if the patients are 75, 80 years old, they're probably on 3 or 4 medications. Can you be on a type 2 diabetes medication or osteoporosis medication or even a blood thinner and still get this procedure?
Absolutely. So we work with the medical doctors, right? We talk to their primary care doctors, we talk to their specialist doctors, and we make sure that the patient is truly a candidate for an implant surgery or any sort of surgery prior to the procedure. So working with the doctors is the most important aspect of.
So the answer is you could have type 2 diabetes and get this done.
Absolutely. You can, as long as your diabetes is under control, and we can help the patients realize, what they need to do to keep their diabetes under control.
Is it true, though, that most of these patients in their 80s are on multiple medications that are getting this done?
Absolutely. There's patients that are on medications that make implants a little bit difficult to place for them. So we will investigate that. We'll make sure that the patient is a proper candidate for implants.
But is that rare, usually? I mean, have you ever had to turn people away?
It's rare that we have to turn someone away, because a lot of times working with their primary care doctor, we can take them off their medication for a little bit of time.
Okay.
So sometimes they take a drug holiday and then they become an implant candidate, and then, they get the implants and they go back on the medication that they need, afterwards.
So no more dentures. That's the future.
No more dentures, absolutely.
All right. I want to thank you for coming on the show. Should they go to your website to make an appointment or just call your office?
They can do either. So we are Surgical Arts of Boca Raton and Dental Implant Centers, and you can go find us online, or you could call us.
Okay, great. Thanks again for coming on the show.
Thank you for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.